What kind of infection causes UTIs in children? Imagine a tiny invasion happening inside a child's body that can make them feel uncomfortable and sick. Most of the time, urinary tract infections in children are caused by bacteria, tiny living organisms that can multiply quickly and cause trouble. The most common bacteria responsible is called Escherichia coli, or E. coli for short. This bacteria normally lives in the digestive system without causing harm, but it can sometimes find its way to the urinary tract, especially if hygiene habits are not perfect. It often enters through the opening of the urethra, which is the tube that carries urine out of the body. Once inside, E. coli can stick to the lining of the bladder and multiply, leading to infection. If not treated, it can sometimes reach the kidneys, causing a more serious illness. While E. coli is the main culprit, other bacteria can also cause urinary tract infections in children. These include Klebsiella species, Proteus species, Enterococcus species, Pseudomonas aeruginosa, and Enterobacter species. In some cases, especially in teenage girls, a bacterium called Staphylococcus saprophyticus may be involved. Although fungi can cause urinary tract infections, they are much less common in healthy children. The way these infections happen is often linked to anatomy and hygiene. Girls are more prone to UTIs because their urethra is shorter and closer to the anus, making it easier for bacteria to reach the bladder. Boys, especially if they are not circumcised, may have a slightly higher risk during infancy, but this risk decreases as they grow older. Good hygiene practices, like wiping from front to back after using the bathroom, drinking plenty of fluids, and urinating regularly help prevent bacteria from entering the urinary system. Children with UTIs may show different signs depending on their age. Babies might have a fever, be fussy, refuse to eat, or vomit. Older children might complain of pain or burning when urinating, need to urinate often, or have lower belly pain. Because symptoms can be subtle, especially in young children, caregivers should watch for any changes in behavior or health and seek medical advice if they suspect a UTI. Diagnosing a UTI involves a simple urine test to find bacteria and check for signs of infection. Treatment usually involves antibiotics, which are chosen based on the bacteria identified and local resistance patterns. It is very important to finish the entire course of antibiotics to make sure the infection is fully gone and to prevent complications. Preventing UTIs in children involves good hygiene habits, such as wiping properly, encouraging children to urinate regularly, and making sure they drink enough fluids. For children who have repeated UTIs or underlying urinary tract issues, a healthcare provider might suggest further tests to find and treat any problems. In summary, most urinary tract infections in children are caused by bacteria, with E. coli being the most common. Other bacteria and even fungi can sometimes be responsible. Practicing good hygiene and seeking prompt medical care are key steps to keep children healthy and free from these infections. Always consult a healthcare professional for personalized advice and treatment tailored to your child's needs.